This podcast is intended as healthcare practitioner education only and is not a substitute for medical advice, diagnosis, or treatment.
I think it's really important to comment on the fact that allergies are the fastest growing chronic disease in Australia.
So what I like about Chinese medicine is it's quite philosophical. So it really goes into, a bit more of a story with things. And I think that really helps sometimes when you're explaining things to our patients, because, we can talk about genes and all the scientific stuff, but it's when you can give them a bit more of an analogy.
So the first case study I wanted to share with you was a little boy who was 6 years old, and he underwent treatment for a 3-month period, but he presented with eczema, so that inflammatory skin condition that affects 1 out of 3 kids in Australia.
This is Bioconcepts Between Clinical Minds, the podcast that's open-minded enough to take in all sides of a clinical story. You'll hear from researchers, doctors, naturopaths, nutritionists and patients. We look at common clinical presentations through a different lens. It's open, frank and sometimes controversial. Nothing is off limits. Will it change the way you treat? We'll leave that up to you. In Season 1 of Bioconcepts Between Clinical Minds, we look at children's health. We talk to experts in the field who will take you into their clinics and share their experience. We'll hear the inspirational stories of change from patients and their families along their healing journey. I'm Tony Chambers, and this is Bioconcepts Between Clinical Minds. In this episode, we talk atopic conditions and food introduction with Chinese medicine practitioner and naturopath Dr. Sandi Ross and Sydney-based naturopath Tabitha McIntosh with a special case study from naturopath Emma Sutherland. 10% of children under 1 year of age and up to 8% under 5 have a proven food allergy. Eczema affects up to 30% of Australian kids and around 10% suffer from asthma. Tabitha McIntosh is a Sydney-based naturopath who regularly sees families in her clinic. She has a strong focus on reducing toxic load.
Actually, the incidence of allergies, whether they be to, food or insects like bees or even drugs, including anaphylaxis, and all of the atopic presentations are so common that 20% of the population is going to have at least one diagnosis of one of these things over their life course. And I think when you're working in private practice, it's almost impossible to avoid seeing atopic children, even if you work with adults only. Parents will always ask you about their atopic children, and 10% of Australian infants have a proven food allergy, and it's our atopic constitution kids that tend to have the highest risk of developing allergies. And there are just so many theories and, complex drivers of why this might be the case. And almost all of them relate back to modernisation or the Industrial Revolution and the impacts and the domino effects that that's had, not just on our microenvironments like our bedrooms and our homes and maybe even the microbiome of the home, but also on the foods that we're eating, things like processing of foods and the changes to diversity in our diet and other sort of dietary drivers or multifactorial dietary drivers for the increasing incidence of allergy and atopy might include the increasing intake of inflammatory seed oils and a shift to that omega-6 to omega-3 ratio. Tony, I think in pictures, and I actually have a mind map that I've drawn in front of me, the role of diet and industrialisation are just 2 points on that mind map. There's a really interesting hypothesis called the Hapton hypothesis or the Hapton atopic hypothesis, which is really an intriguing theory by way of it's an intriguing mechanism to drive allergic reactions. And haptons are small molecules or irritants, including chemicals in our environment, that once they enter the body via the airways or the skin or the gastrointestinal tract, they bind to proteins and elicit an immune response. And the way that I explain this Hapton atopic or atopy hypothesis to my clients is I actually use the analogy, which a lot of people relate to these days, of bandwidth. And I say if there's a certain bandwidth that the immune system has, but there's this constant inflow of whether it be environmental, allergens, things that are airborne, whether, pollens or dust mite, animal dander, or also in, airborne particulate from the fires that we had in Australia, or chemicals off-gassing of furniture, flame retardants, things like this. These are combining with proteins in our body to elicit an immune response and really taking up some of the immune bandwidth such that it has less capacity to make really ordered decisions moving forward. So that's an interesting lens. Just two more points on that mind map I've drawn. Vitamin D deficiency, again, possibly moving back to the urbanisation of the past 50 years because we spend more time indoors. But we know how, that vitamin D is really a master regulator of gene expression.
Just out of interest, where do you clinically like to see vitamin D? Where's optimal for you?
Acknowledging that people tend to drop vitamin D levels by about 30 points from the end of summer to the end of winter. In my clinical experience here, I have a goal that my clients' vitamin D levels sit above 80 nanomoles all year round. And so that might take their, I'd like them to be no lower than 80 at the end of winter, for example. And I'll supplement them and, give them lifestyle advice to help them with that. But I see it as the safest vitamin really. So I don't mind if they're bumping up over towards 140, 150 by the end of summer. But I'm not sort of feeling a strong need to have it over 120 all the time. But 80 would be my bottom point that I feel comfortable with, particularly when working with atopic families.
So just focusing back in on the immune system, can you and given your strong interest in environmental toxins and the impact of environmental chemical load on the immune system, can you just go into a bit more depth there and elaborate for us, please?
I think that there is a strengthening to the data that's coming out on the effects of environmental toxins on the development of allergy and intolerance, but also inflammation. So really, all of those theories sort of point, especially that hapten atopy hypothesis, really do point towards one of the underlying mechanisms behind increased levels of allergic responses. Really appears to be this imbalance of cytokines caused by exposure to toxicants. And a lot of the research actually points to in utero exposure to some of these chemicals too. So there are those windows of vulnerability and the critical windows of development of a child's immune system. I would say there are a number, but particularly in utero, it's become quite clear that in utero exposures can alter the developmental trajectory of immune capacity and initiate allergic disease development. And some French research I just read this morning actually was looking at in utero exposures to heavy metals. So these heavy metals, which we can be exposed to in everyday life, through food, water, air, can have damaging effects on the development of the immune system, even at really low doses. So little bits of cadmium coming in or lead coming in from piping or tap water that's not been filtered, etc. All of these things. Actually, this study looked at maternal blood samples from 706 pregnant women in maternity units in France and cord blood after delivery, and the researchers then followed the children up to age 8. And the incidence of asthma, allergic rhinitis, eczema, food allergy symptoms, these were all significantly higher in the women that the cord blood and the pregnancy tests actually showed elevated serum concentrations of lead, cadmium and manganese. So heavy metals are just one of those. Sometimes they work as antimicrobials, sometimes they work as endocrine disrupting chemicals, but then there are other exposures to things like endocrine disrupting chemicals, whether they be in fragrances, phthalates, food packaging chemicals, and, thermal receipts and canned foods and things like this. these endocrine disrupting chemicals can also derail immunological and neurodevelopment and have very big impacts on how sensible the immune system is throughout infancy and beyond.
You mentioned, a few exposures there or sources of exposures. In your experience, is there one exposure that's more common than others?
It's really hard to tease them apart, but it takes a great deal of education for the client to be able to move away, education, but also inspiration for them to move away from plastics if they haven't yet learnt these things. And this sort of reflects back to or circles back to the importance of education and preconception care, where we're sort of in a multi-prong approach. We're really educating those families or clients on moving away from using plastic water bottles and plastic Tupperwares and reheating food in the microwave in plastic containers, etc., etc. I tend to give grocery items lists that are screenshots of the items, so really practical shopping lists for people to buy, where I'm sharing with them photos of tomato paste that's in a glass jar, or even fish, small fish like sardines that are in glass jars rather than cans, and we talk about talk about these chemicals as a load on the immune system and on the detoxification systems of the body. But I was going to say that there are probably two other main, really common daily environmental exposures that come to mind. One of them is actually chlorine and chloramine and those disinfectant chemicals that are used in tap water. And the reason it came to mind, Tony, is because of the way that chlorine and chloramine are such immediate irritants to both the airways and the skin. So talking about, I know I'm jumping from in utero exposures now to infancy exposures, but I see time and time again little infants and toddlers eczema far worse after a warm bath, or far worse after swimming lessons, or asthma attacks after swimming lessons, or after long hot showers where a lot of that chlorine and chloramine is vaporizing and the kids are breathing that in. So there is some, in terms of practical advice around this, if the parents are observing that themselves, there are some fantastic, really cost-effective, and you can even insert them yourself, or you don't even need a plumber. There are some great filters. One of them is the Sprite filter, that whilst it doesn't remove everything like a reverse osmosis filter, it can be added on as an adjunct to the bath tap or the shower recess to just remove the chloramine and chlorine treatment chemicals at that exit point, and just to have a really big impact on those kids' immediate reactions to the chlorine exposures.
But when you talk to your patients about this, how do you feel? Do you feel that they become overwhelmed, or how do you take them through that journey of understanding environmental toxins and how to live with them, I suppose?
So my clinical lens, I actually draw on a piece of paper and share with my clients. And my clinical lens is a diamond. And so at the top apex of the diamond, I write the word genetics. And of course, that helps give the clients context when I take their family medical history. I'm wanting to look at constitutions and weaknesses and strengths and things like that. But then as I draw the diamond down to the left apex, I use the word nutrition. And we talk about how there can be obviously nutritional antigens that can drive atopy, things like eggs and dairy and peanuts and tree nuts and things like that, sesame seeds, etc. But I also talk about how we can use certain nutrients to strengthen resilience against allergy and to really create robust immune capacity. For example, the vitamin D we were talking about before. And we can also use some nutrients as anti-allergic, antihistamine, mast cell stabilizers, things like vitamin C, quercetin, biflavonoids. The right-hand side of my clinical lens apex, I discuss the environment, and I start really gently with the environment. But I am planting seeds in that first 5 or 10 minutes of my consult, because I'm talking about environment as a lever that can impact the expression of genes. And I'm encompassing things like how we respond to stress, sleep quality, sleep duration, exercise, how the body moves. And then I go on to mention things like dampness and mold. I go on to mention things like fragrance candles and perfumes and food packaging chemicals. And if I have a particularly health literate, client or couple in front of me, I will go on to talk about pesticides and the dirty dozen, and also in that environmental apex, I'm talking about things like dust and dander. And whenever I draw this diamond, I've only mentioned 3 apexes so far, but whenever I draw this, I think it gives the client fantastic insight as to how I'm able and interested in working with them, and they end up sort of engaging and volunteering information to me. Of course, I have to be clever with my questioning, but they end up saying, yeah, actually, when I lived in that really damp, mold-ridden home, my symptoms were so much worse. Or when I got a filter on the shower head to filter out the chloramine and chlorine chemicals, my skin got a lot better, etc., etc. So I will go on to the 4th apex of the diamond, which is, you can imagine, sort of directly opposite the genetics. And that apex, as you might imagine, is the health of the microbiome, or the diversity of the microbiota. And that probably ties us back to one of the multifactorial complex drivers of the increased incidence of allergy and intolerance in Australian kids. It's really the loss of diversity to the microbiota, and whether we tie this back to increased incidence of surgical births or drops in endurance of breastfeeding, or more bottle feeding than normal, or packaged food, or, like I mentioned earlier, the impacts of food processing and intakes of inflammatory seed oils, and lack of fibre too, really, because of the impact of our beautiful dietary fibre from our plant food, not just actually generously giving us polyphenol antioxidants like quercetin that can act as antihistamines, but also that can act to dampen some of the inflammatory component associated with allergies and intolerance, but also because these fibres act as prebiotic fuels to nourish a diverse and really active microbiota. So that's my clinical lens, my diamond, and almost every presentation, Tony, falls, somewhere into that diamond. It doesn't have to just be atopic kids or kids with food allergies.
And can that kind of thing explain, there are some children, for example, who may not have had eczema, as a baby or as an infant, but they actually acquire the eczema. Can changing house and, exposure to those, maybe greater levels of those in the environment, contribute towards eczema?
Absolutely. So I see that atopic tendency in, parents or an infant as a light switch. And again, because I'm so visual, Tony, I'm going to go back to that clinical lens, the diamond. So they may have that genetic light switch present, and it may be off, but then it could be something like a winter vitamin D deficiency combined with a growth spurt, which renders that infant or child, iron store deplete. And we know that iron store deficiency can have an impact on deregulating immune responses. So we need to have a decent amount of iron. Recommended daily intakes for infants and toddlers are really significant and really hard to achieve via diet without really good education. A lot of sort of toddlers need more iron daily than their dads, so it's really hard to achieve. So we've got that genetic light switch, maybe a couple of nutritional circumstances like a D deficiency and an iron store deficiency. And as another nutritional component, maybe they've been overeating a particular type of food. But then you're right that on that environmental apex, maybe they're underslept, something stressful's going on at home, which again, white noise in the background of the immune system, and a lower threshold for making a sensible decision. But then the exposure to chlorine starts to irritate the skin because, looking at that 4th apex, maybe there's been an insult to the gut. Maybe they've just had a nasty gastro, or they've required an antibiotic course for an upper respiratory tract infection or an ear infection. So it's always multifactorial and complex in terms of the drivers. But yes, it's likely not just one thing that's going to switch on an eczema picture. It's likely all 4 of those apexes on the diamond that are going to be sort of activated to lead to that newer diagnosis.
So in Chinese medicine, we talk about something called prenatal jing, or our essence, and this is actually stored in the kidneys. So for any of the practitioners that have worked with Chinese medicine or had acupuncture, they've probably heard a little bit about their kidneys being deficient, and that's kind of in relation to our adrenals. So this prenatal jing is sort of set from when you are born, and you can't change the prenatal jing. So that's the same as our DNA. And so in Chinese medicine, they sort of break it into 4 stages to get that prenatal jing, or that vitality, which makes up your basic constitution and your strength. That's going to be there. You can't change that from birth.
Dr. Sandi Ross, Chinese medicine practitioner and naturopath on the Gold Coast. She specialises in women's and children's health.
That's the first stage of development. So that's obviously before the baby's born. The second stage is actually my favourite stage to discuss, and that's from birth to 1 month of age. And so I'm sure now many practitioners have heard of the first 40 days, or the golden month, or sitting the month, whatever you want to call it. And this is something that's so influential on the mother and the baby. And so if you actually look through history, every culture around the world practiced some sort of, staying home, resting, nourishing the new mother, nourishing the new baby for around 1 month to 40 days. And it's so important that the West has really forgotten kind of how to look after the new mother. You get a lot of care here. The maternity care is great, I think, in the West. But once you have the baby, you're sort of like disposed of, and there you go. And you get a midwife come and check on you a couple of times. And then you have obviously all these people come and visit you. And it's a lot of stress for a mother to get up and make a cup of tea and stuff like that. So we really want to nourish the mother in these first 40 days. And it's all about skin to skin, which actually dominates what we call the po, or the lung in Chinese medicine. And the lung is all about our immunity. And so this is where mum just needs to stay home, breastfeed, skin to skin, keep warm, eat warm foods, not expose themselves to any winds or drafts. And that really helps to build up that first stage of the immunity for the child. The third stage is 1 month to 1 year. And so this is actually governed by our spleen, which is like our digestion. And so this is where, the child's having rapid growth, their immunity is forming from their milk, from breastfeeding, or from the formula. But, the child's obviously going to be the baby's going to go out and play outside a little bit more, be in the grass. So they get exposure to bugs and wind and those sorts of things. So we can tend to see a few little ailments start to arise here. A lot of heat is something that really affects this age group as well. And we get heat from, immunisation even, when a fever occurs, or if they go out at the beach and it's really windy and then they get a bit of sunburn. So wind is something that really aggravates this age group. And I can maybe talk about wind a little bit more later on, but it's something to really, think of when you are taking our young kids out is the environment, and to try and not get them exposed to much wind. The other thing in this age group is the spleen can actually cause a lot of food accumulation because their digestion is immature and still weak. They are really prone to, food accumulation, and that can be colic with digestive problems, or anything that comes from food stagnating and then causing heat, which we can see as like fever, or, this is where our eczema and stuff arises. And then the fourth stage is from 1 year, to 3 years old. And this is actually governed by our kidneys. And this is where the willpower becomes really, strong. And this is where kids are saying no, and, they're standing up for themselves, and they become defiant. The spleen is usually stronger, but they are prone to more wind invasions. This is when they're talking, and this is actually an expression of the heart qi. And so when we see problems with speech, we actually connect it back to the heart in Chinese medicine. And this is when they're starting to walk. And so that's connected to the stomach meridian in Chinese medicine. And then they're developing their teeth as well. And so that's connected to the kidneys. So the fifth stage is from about 3 to 7 years. And this is dominated by our liver. And so this is all about kids being creative, artistic. And then this, obviously with the liver, we know the saying liverish, and the moods that can come with that. We often see that in this age group as well. They can have tantrums and get angry quite easily. And they're really susceptible to invasion of external winds. So they get colds and flus and ear infections and tonsillitis and all those sort of mixed wind invasions, we call them in Chinese medicine. But their digestion is becoming really strong. So it's a great time for them to start eating different foods and trying new things. And then the last stage I'll talk about is kind of the sixth stage, which is around 7 years. And this is when their Shen, which is like spirit and mind, is developed, and our Yi kicks in, which is our intellect. And so in Chinese medicine, it's really connected to that sort of Steiner philosophy. Around 7 years of age is when children should start actually using their intellect and being a little bit more academic. And so beforehand, it's governed by the liver, and we sort of want to just really nourish creative play and that artistic ability in the child, but not sort of enforce that academic aspect just yet, because it hasn't actually matured in their cycle. And so that's around that 7 years of age. It's actually around 8 in boys, and boys develop a little bit slower. And sometimes it's just understanding and hearing these kind of philosophical ways of actually bringing emotions and, all these other parts of the 5 elements into our practice.
Absolutely. I find it really interesting. Can I just pick up one of those, the comments that you made, particularly the one that you made in the 3rd stage, so 1 month to 1 year, and you mentioned food accumulation and that kind of linking to eczema. Can you just explore that a little bit more for us, please?
So with kids, a big common thing we do see obviously is eczema, and this is more so in sort of babies or around the time of food introduction is a massive one where I see eczema arise, and it definitely can come earlier. So in Chinese medicine, we talk a lot about food accumulation, or otherwise we can call it food stagnation, and that's basically like the body is not digesting the food well. And so that can come back to a weak spleen, which is your digestive tract. And when the food accumulates, it'll actually cause usually heat in the body, and then the heat will arise and manifest on somewhere that might be a weakened constitution. So often it's, the lungs in Chinese medicine, which is the immune system, and that's when we start to see things on the skin. And eczema can come in different ways, shapes or form. It can be, damp heat from the environment or diet. It can be food stagnation, from the introduction of food. And vaccine stagnation too. I'm not anti-vax, so I won't go down that rabbit hole, but, there is a common theme we do see with the vaccine stagnation, we call it. And then other things like, the dampness that accumulates in the digestive system from, dairy and sugars and all that sort of thing as well.
So if you had a child present with eczema as one of the presenting conditions, could you go through how you would apply understanding the environment, the emotions and digestion from TCM into treatment for that child, please?
So I do see a lot of eczema and I see it a lot in babies. So the first thing I always do is go through the pregnancy and the emotional health of the mother and all that sort of stuff, because one thing I haven't mentioned is guilt is actually a big one, and grief that a lot of mothers actually experience, or shock and trauma through their pregnancy, and that really affects the quality of the immune system or the lung energy in Chinese medicine, or the kidneys. And so they're 2 of the organs that are very much associated with eczema. And so I'm already, trying to find out and dig a little bit to investigate what's happening here, why. And then obviously I'm going through, the pregnancy, the birth, and then the foods and, the quality of the child's health and the environment that they've been in, to try and assess, what's been introduced first. And so commonly the cold foods have come in. And this is not for everyone, but just to kind of give you a pretty common picture of an eczema baby or child. And so it might mean, okay, well, let's change the diet around. Let's take out things like avocado and banana, because they cause a lot of dampness in Chinese medicine, and eczema can be quite damp. Usually it's damp heat. And let's warm up the diet a little bit. Let's go no raw, no cold, and do things like porridges and things like rice and oats, and all your grains are great for children. And we now know they're all prebiotics, which is so important for that microbiome development. And we can sort of take away the stress of trying to get greens into our children, I think, now with the studies around the microbiome. Obviously, greens are great, and they've got things like the folate and the B vitamins, but a lot of our grains actually have that too. So, it's been pretty liberating as a naturopath to follow the research and to go, okay, well, now it's kind of not so much about trying to get the greens in, it's more about getting the fibres in. And so, getting the mother to change to a more fibre diverse diet, which is going to be a bit warm, and obviously getting those vital nutrients in, like, iron needs go up massively in children. So are they getting things in their diet that they have enough iron and zinc, and going through some of those core minerals that we use every day with naturopathic medicine. And then I might use some probiotics. So obviously we've got some great probiotics such as Lactobacillus rhamnosus for skin. And so I'll obviously, use my naturopathic tool for what's needed there, or basic things like, the zinc, and if we can do a zinc tally test and check their zinc status. These core naturopathic nutrients we have work really well. And sometimes I'm giving prebiotics. So, that's really easy to give now. They usually got no flavour, and you can either put them into formula or you can mix them into foods. And so just doing some very basic naturopathic stuff to start with while working on the diet. And then I also use a tool which is called Shoni Shin, which is actually like a Japanese non-acupuncture tool that we use on babies. So it's acupuncture for babies, but there's no needling. So it's a really nice tool that I can actually use as a treatment in clinic. But obviously naturopaths listening don't have access to that. But what you can do is massage is really good to help clear the heat, which is obviously associated with eczema. And then sometimes I'm looking at, depending on the severity, I might go into genetic testing and look at, the Dow gene and then treat more that histamine relation, or I might use some nice herbs. And, I am naturopathically trained, but I'm also Chinese medicine trained. And so I kind of have a little bit more of an understanding of the energetics. And so, as a naturopath, there are some great books out there now, herbal handbooks that actually go through the energetics. So it might definitely be worthwhile looking at your herbs and making sure you're not giving herbs that are going to be superheating. So there's, some great heat clearing herbs in there. And I love things like Atractylodes or Astragalus or Chrysanthemum or I can't think off the top of my head, just to help with clearing some of the heat out of the system. And these are herbs you don't use long term when you are clearing heat, because you don't want to make them cold either. So, just short-term treatment of herbs. And kids love taking herbs if you can get them in glycy tracts and stuff.
Well, you mentioned prebiotics. Which ones do you favour for kids, or which ones do you like using for kids?
Well, sometimes I'm doing stool testing. So if I do stool testing, it might depend there. But yeah, I'm often using, PHGG or FOS or GOS, just some of your basic ones, just to kind of get that diversity in. It obviously depends on, if it's a baby that's been born C-section or, and sometimes I'm just using the probiotics like the LGG, for example, and that works really good, or sometimes I'm using the combination. But, I really push for the diet with the prebiotics, but they are a very easy supplement to give to kids. And obviously that's a massive thing with children is supplementation. It's really hard to get the supplements we want into a child. And actually the other thing I'll just touch on there is cod liver oil is another great one I use with eczema with children, because it's really rich in vitamin A and vitamin D. So both are amazing mucous membranes and immune support, and easy to give to children as well.
What's important to know about food introduction with babies?
So the first one is, like I talked about, that digestive fire, and sort of just understanding that and explaining that to your patients really helps with them understanding why they shouldn't be doing the raw and the cold food, because otherwise they're going, oh my gosh, like a smoothie is the easiest thing. Everyone's sort of making things up and putting them in ice cubes and then serving them to their children. Most people will kind of warm it up, but you do see kids having these colder foods. So just because it's healthy doesn't mean it's going to be healthy served cold. So no raw and cold foods, and all these greens, they do need to be cooked before, we serve them to our children. So definitely no like frozen raw greens. That's probably the hardest thing for their gut to digest. And we know that, cellulose is really hard to break down. Cows sit there chewing for hours on their food to really break down the cell wall, the fiber. And so we just can't blend it up and expect these little immature digestive systems to be able to do that. So first rule of thumb is no raw and cold foods. And I'm pretty strict with that. Now, the second thing is, so you could do things like casseroles and root vegetables. Root vegetables are great to introduce as a first food in Chinese medicine, as they're actually really good for that spleen energy. So the orange and the yellow root veggies are going to be really spleen tonifying. So they're great. They're just, pumpkin, sweet potato, carrots. They're so easy to give to kids. Grate a little bit of liver in there, or mix a little bit of cod liver oil in there, and that's a fantastic food to introduce. I love a bit of egg yolk into baby's food as well. Obviously not so much the white just yet, but, cracking the egg yolk after you do a little soft-boiled egg and mixing that into the root vegetables. I always say no yogurts yet, no cow's milk sort of in that first year of life is how I try and go with the dietary, introductions. However, if they're having formula, that's okay. Oatmeal is a great one, with some apple and pear in there and a bit of cinnamon or some nutmeg. And another one is a congee, or what the Chinese call juk, which is that rice congee. The very first food that a child gets in Chinese medicine is they boil up the rice and actually scrape the water out of the rice and give that to the baby. So that's a rice water. And so that's the first thing. And that's full of all those fibers, right? So it's prebiotic rich, and it's going to have all those great things to help build up that diversity of the gut. And then they'll do things like congee and really easy to digest, like things that just won't cause any stagnation or accumulation in their gut. The Indians do like a kind of dal and rice sort of thing that's really, really soggy, and, just really basic kind of these grains and fibrous foods that are soft and really well cooked are really great to introduce. So, even the oatmeal, which is such an easy one to do. And I was sort of delaying grains with my children when I was first introducing, with my daughter anyway, but now I, have a different perspective on it. And so they're just a couple of the, key things to understand when you are introducing foods, and just a few things that you can give as ideas for children with the introduction of foods.
You've been very, very generous with your information in terms of your clinical lens. But as far as approaching a child who comes to you who has an allergy or multiple allergies, how do you approach? You obviously look through your clinical lens. Is that the first step that you take?
Yeah, it is. So I'm thinking about, I make a joke, is it mummy's fault or daddy's fault when we talk about the gene apex at the top? Sometimes it's both. Quite often, if it is both, I feel a sense of private regret that I didn't catch them earlier because of some of the data that we have that's been published on oral probiotic supplementation during the latter stages of pregnancy, when because obviously allergic disease and atopy, there's a higher risk for that infant determined by the medical history of the parents. And there's a strong hereditary component, right? So if both parents have a history of eczema, the offspring's risk of eczema is 60 to 80%. And I even saw this published on the RACGP's website, for example. But probiotics in particular, Lactobacillus rhamnosus GG strain, can reduce the relative incidence of eczema in that child by almost 80% when that strain of probiotic is supplemented in the mother from about 34 weeks gestation all the way through via mum until that baby's at least 6 months of age. And in some of the research, actually, that specific strain was also supplemented via breast milk or formula to the infants. But, we have NHMRC evidence level 1 that this can reduce atopy expression in the infant by 80%. So that's a bit of a side note, but so I will feel some regret that I didn't catch them earlier. But yes, I'll look at their environment. I'll try to understand if their symptoms, whether it be, wheeze or asthma or eczema, if they disappear on holidays, or if it's particularly aggravated when coming back from grandma and grandpa's house or something like that, because I have absolutely had kids and toddlers that have had recurrent asthma and upper respiratory tract infections. And it's only really on digging down deep into what the week looks like that I realise grandpa smokes and they go to grandpa's house 2 days a week while mum works. So I might ask around mould. Of course, I'll ask about things like the mattress, the age of the mattress, and if there's allergy protectors on the mattress and the pillows and the doonas and blankets and things like that. I'll ask about pets. Not that we ever want to get rid of family pets, but if a child has developed an allergy to, cat dander or dog or something or guinea pig, then it has to be looked at. And I would be inclined to prescribe a probiotic to the child. And I'd also be inclined to work on inspiring mum and inspiring that infant, if they were old enough to have a conversation, on diversifying the number of plant foods on their plate at each meal, every single meal, to increase the diversity of the microbiome.
What kind of balance do you have between supplementation and diet? You obviously do supplement in children as well.
Yeah, I do, but absolutely. But, being a parent, as you are, Tony, it has to be practical and it has to work. So I genuinely feel that the foundational support is the dietary and lifestyle support. It genuinely getting back to basics. So can we put a filter on the water? Can we swap over the water bottles to steel? Can we try to be preparing a bit more food from home? Can we be looking at, say, the Environmental Working Group's Dirty Dozen list? And if there are any of those foods, it was just published recently, the 2021 list, and the Dirty Dozen include, cherries, peaches, pears, spinach, strawberries, apples, grapes. I think I mentioned spinach, but also kale and celery, tomatoes. If those are a really predominant part of the child's diet, can we swap just those foods over to certified organic to reduce the pesticide load? Can I also work to inspire the kids? I actually use a rainbow checklist. So I ask kids to eat the rainbow every day for me. Can I inspire them with pictures and snack ideas and a rainbow checklist to be eating more vegetables? Swapping over boxes of sultanas with sulfite preservatives to capsicum sticks, tricolour capsicum, or cherry tomatoes that are organic, or et cetera, et cetera. And, are they getting enough sleep? And can I prescribe a probiotic if there's been a number of insults to the microbiome, like gastros or antibiotics for infections, et cetera? So to me, all of that stuff is very foundational. And then, of course, it comes down to the age of the child. If it's a bottle-fed infant, I'd be inclined to prescribe something like a cod liver oil, a flavourless cod liver oil that can be added into the formula, or that can be even added in at introduction to solids, or some express breast milk, and I'd be inclined to prescribe an age-appropriate probiotic strain. It's not until the child's a little bit older, say over 1, that I might look at using some iron or zinc or some vitamin C powder and some quercetin or quercetin. I try to supplement minimally, but, when I'm by the age of sort of 10, 11, 12, I would never prescribe more than, say, 2 things in the morning and 2 things in the evening to a child that age, but I would be inclined to do that based on blood results or a really thorough diet review.
Is there anything that you're watching in the research as far as a nutrient or a herb that might help you that you haven't implemented yet, but you're just watching, or any out-of-the-box treatments that have worked over the years in your clinical experience?
Look, I may use a questionnaire, an environmental questionnaire, to help guide me as to where to invest my time best with the client, in terms of if it's more of a home environment thing, or, there's a lot of takeout being purchased each week, or processed foods, etc., or fragrances being used. So a questionnaire can save a bit of time in terms of where to focus on environmentally. But I didn't discuss detox much, and I know that it's a really loaded word, detoxification, but I make it a priority to ask about all of the different detoxification systems in the body. So are they getting enough water? Are they peeing lots of times, or lots of wet nappies? Is the bowel emptying completely daily, et cetera, et cetera? Are they eating sort of lots of the plant foods? I pretend to be a seesaw, and I talk about the 5 veggies and the 2 fruits. Are they getting all of the fibre in from their veggies? Because coming back to the Hapton atopic hypothesis, we can have quite an impact on upregulating all of the different detoxification systems in clearing some of these toxins and chemicals from our blood and from our bowel, and preventing enterohepatic recycling of toxins and things like that. So it's not really out of the box, but it might not be front of mind when you're working with an atopic child. But absolutely making sure that all of the elimination channels are working well and open, and that we're supporting detoxification with some gentle supplementation can actually have a really loud effect on immune tolerance and allergy.
And when you're working with a child, what are those gentle detoxification supplements that you would consider?
Again, it depends entirely on the age. It might be in a young infant that I'm just trying to increase the brassica vegetables, for example. I'm trying to get them, having a little bit more broccolini, a little bit of cauliflower and leek soup, or a little bit of a brassica soup, or some roast cauliflower, if I didn't mention that, roast veggies, or and drinking more water. Probiotics, there are particular strains that are stool softening as well. I might look at prescribing, I'm certainly not going into the N-acetylcysteines and the glutathiones in infants and toddlers, but I might look at, iron again is necessary as a cofactor for some of the detox CYP450 enzymes. So I'll make sure they're not really iron store deplete. I might use some zinc based on that child's age and body weight. I might prescribe a zinc with a vitamin C and a quercetin. So really basic foundational stuff. I tend to see that kids and infants respond beautifully to simple measures.
We spoke to Sydney naturopath Emma Sutherland in episode 1 about stress and epigenetics, but she has so much clinical experience to share. She sees many children with eczema, including this 6-year-old boy whose case was particularly severe.
It was waking him up multiple times in the night. His eczema was all over, but most specifically, the inner elbows and behind the knees and those classic areas. Now, he had been given antihistamine so that he could sleep at night, and the parents had been given steroid creams for him, which were effective sort of short term, and then the eczema would just come back again. So the parents were really looking for a bit of a holistic treatment for their son because they were recognizing that the antihistamines and the steroids weren't going to make him better. So in the case history, it was a natural birth, which was great, and he was breastfed for 12 months. He didn't have reflux, which I often think is a bit of a flag for me for atopy. He had ear infections, so quite badly, and he needed to have antibiotics. It was 2 separate incidences for those. And looking at the family history, both the mum and the dad had atopic conditions themselves. So the dad had eczema, the mum had food intolerances for her. So what I always think about, especially working in pediatrics, is what was the disrupting factor to that child's microbiome? What was it that skewed things and potentially altered the microbiome so that the epigenetics was then expressed differently and brought out that symptom in the child? So for this little boy, I put him on lactobacillus LGG. So, research is so lovely for this probiotic strain that it really helps to communicate to those dendritic cells and really communicate and stabilize the Th1, Th2 response. I put him on quite a big dose of zinc because that helps maintain that skin barrier integrity, and of course some omega-3s to try and reduce the inflammation and settle down that itch. And really within 6 weeks, when the mum brought him back, the mum was like, wow, he's sleeping through the night. So that irritation, that internal irritation was much softer, and his skin had lost that aggravated redness to it. And then I saw him with his father maybe about 3 weeks ago now, and this little boy was full of beans. He was racing around the playroom that we have here, and he was causing a bit of a ruckus. But when I first met him, he was very subdued. He was quiet. He was irritated, and I could see the difference in this child. But sometimes we just have to think about some research-based, very key nutrients in these cases can make a profound difference. So really it was supporting the gut bacteria and the balance there within the gut itself and skewing it back on the immune response and just modulating that immune response. So that was a beautiful case study of eczema, that simple things work really well. And, it's interesting because when parents come in, they're usually doing already a lot of correct things. They weren't using soap, they weren't using, chemicals around the house. They had done all the logical things that you do with eczema, but it just needed that tweak internally of his microbiome to really reduce that symptom of eczema for him.
But I asked Emma what his diet was like.
His diet was actually already really good. So this is I have very proactive patients. The mum was giving him fish. He wasn't having gluten. He was eating a whole foods diet. There wasn't a lot of dietary tweaking for him at all. So I think by memory, I pulled him off eggs Yes, I did. I'd said to the mum, look, temporarily, I want him to not have eggs for a period of time until his skin is better, and then let's reintroduce the eggs and see if it, makes it worse or not. So I put him off eggs. So when we do food intolerance testing with kids, we often see eczema linked with eggs, dairy as well, but particularly eggs. So that was just an easy dietary intervention to make. And it's a temporary one as well.
As far as testing's concerned, it's not the first place she goes.
So I do a lot of functional medicine and I am very proactive, but I often get patients coming to me that are on very kind of complex protocols and have done, sometimes the best approach is, less is more. And often saying to parents, hey, I'd really like to start with these simple strategies and see how your child responds, because that could be all that we need to do. It may not be, but I'd really like to start with that. And keeping it simple, I mean, for any parent out there, if you are given a complex protocol for your child, it is so overwhelming. So I really feel for parents having done many protocols with Sophia myself that, if we can do it simply and easily, then that's the path we should be taking.
In the next episode of Between Clinical Minds, we talk to dietitian Rocco DiVincenzo and Brisbane nutritionist Deborah Smart to get their take on intolerances, and hear again from Emma Sutherland with another interesting case study. Thank you for listening. We hope this podcast engaged and empowered you. And thank you to all of our experts. You can read more information on each of them on our website, bioconceptsengage.com.au. If you enjoyed this episode of Between Clinical Minds, please refer a friend and share the love. To continue the conversation, you can contact us at bioconceptsengage.com.au, where community is more than a concept.